pelvic floor disorder is when your pelvic floor muscles weaken and you end up with urinary incontinence. And about 6 to 10% of the population is affected by urinary incontinence. And in today's episode, I'm going to be talking about pelvic floor disorders in women and how they can contribute to urinary incontinence. But I'm also going to share some new technology with you that combines gaming with pelvic floor exercises that can actually make pelvic floor training kind of fun. And you can save 25% on this new product that you can use at home. It's called Perifit. So stay tuned to the end to get your discount code. So welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I am a nurse and a nurse practitioner with over 25 years of experience caring for older adults and their families. Before we dive into today's topic, I wanted to share a few of the different ways that you can connect with me. You can go to my website, melissabphd.com, and sign up to be an HyU Insider for free. And there you can find all of the downloadable handouts that I've developed in one place. And if you upgrade to become an HyU MVP member, you will have access to a digital hub of videos, courses, and resources that I've organized by subtopics, which makes it even easier for you to find the information that you're looking for. And I also host a monthly live Q&A webinar for my MVP members. But you can also become a member on YouTube, and depending on which level of membership you choose, you can either get early access to the weekly episodes, you can join me for a monthly live Q&A webinar there, or you can tune in weekly for a live stream with me on Tuesdays at 5. So now let's dive into today's topic of urinary incontinence and pelvic floor health. So contrary to common belief, the weakening of your pelvic floor muscles is not unavoidable. You can practice pelvic floor exercises and you can use biofeedback technology so that you can effectively strengthen your pelvic floor to improve your overall well-being and improve your quality of life. Also, contrary to popular belief, urinary incontinence is not a normal part of aging. So on today's episode, I'm going to share a new device that teaches you through biofeedback how to do Kegel exercises and reduce incontinent episodes. Plus, like I said, I have a special discount code for you to get 25% off. So stay tuned to the end so that you can get that discount and save on your purchase. So first of all, let's talk about what I mean by pelvic floor disorders. And for the focus of this episode today, I'm really just talking about urinary incontinence. And then we're going to talk about how to use biofeedback to improve these symptoms. So the first type of incontinence is stress incontinence. And this is when there's involuntary leakage of urine when you cough, sneeze, or laugh. So sometimes maybe if you're doing an activity like running or jumping, it can cause your bladder to leak. And this is actually the most common form of urinary incontinence, and it occurs in about a third of women. Urge incontinence is the second kind. It's also called overactive bladder. And this is a sudden, intense urge to urinate. So it often requires an immediate search for a restroom. And it reminds me of that commercial, gotta go right now. That's urge incontinence. And then mixed incontinence is when your urine leak occurs either with physical activity, or you cough or sneeze, but you also have the urgency to urinate. So that's called mixed incontinence. There are other types like functional and overflow incontinence. And if you go to the blog on my website that accompanies this episode, there's a link if you want to learn more about those types of incontinence. So what are the first steps if you're experiencing any of these symptoms? Well, I would recommend that you start with an evaluation by your primary care provider, a gynecologist or urologist that specializes in incontinence for women. And so this specialty is actually called urogynecology. So incontinence is not a normal part of aging. I want to stress that, no pun intended. So it should be investigated early and not ignored. So don't just try to manage it with incontinence pads, because the provider can review your medications to see if it's due to one of those. They can also make sure that you don't have a bladder infection. They can perform a pelvic exam to make sure that nothing structural is going on, like a bladder prolapse or a bowel prolapse or a uterine prolapse. And those things happen when one of those organs kind of sag into your vagina, but they can cause incontinence. So what causes pelvic floor weakening? Well, it's usually associated with several different factors, and these include aging and hormonal changes. So as we age, our pelvic floor muscles naturally weaken, and they can lose some of their tone and elasticity due to a lack of physical activity, but also some of the physiological changes that happen with aging, including hormonal changes, such as those that happen with menopause. The second thing would be impact sports. And this is one that I didn't really ever know or think about, but about 90% of female trampoline athletes experience stress incontinence. And I was like, what's driving that? But it's basically any sport that has repetitive jumping and landing motions. So this includes basketball, volleyball, or running in place. Any of those things can cause your pelvic floor to muscle. Repetitive heavy lifting, because you're straining kind of downwardly in your abdominal cavity, but maybe not lifting up in your pelvic cavity. Being overweight puts extra pressure on the pelvic floor muscles, which also makes them weaker. Giving birth. So pregnancy and childbirth put a lot of pressure on a woman's pelvic floor muscles between carrying the baby and giving birth. It can stretch and sometimes damage those muscles, particularly if you have a large birth weight baby. And I had 3 of those. But a lot of times this type of incontinence is temporary and it resolves after the first couple of weeks of giving birth, but it can last longer if you had a traumatic birth experience. And then the last 2 factors that can play into this is chronic exertion during bowel movements. So if you are straining because you're constipated a lot and you're straining to get to the bathroom, that can weaken your pelvic floor muscles as well. And then lastly, medical procedures. So if you've had a hysterectomy, any type of procedure like that could impact the strength of your pelvic floor muscles. So now let's talk about some of the different treatments. And there are a lot of different treatments that your provider can guide you through. These include behavioral therapies. So these are things like bladder training and scheduled toileting. And that's where you kind of set up a schedule to where you either prolong the amount of time between visits to the bathroom, trying to get your bladder to kind of get used to expanding and being at a larger capacity. Because if you're going to the bathroom a lot, then your bladder stays small, and then that could make you have more frequent need to go to the bathroom more often. And also schedule toileting so that to avoid like the overflow or the urge, meaning if you went to the bathroom every 3 hours instead of waiting 4 or 5 hours, then you might be able to avoid some of the leakage that occurs with the overflow. The next thing are dietary modifications. So eliminating bladder irritants like coffee and alcohol and even citrus fruits might help. Pelvic floor rehabilitation, and this includes Kegel exercises, the biofeedback example we're going to talk about today, wearing vaginal or inserting vaginal weights to train your vaginal wall to get stronger, as well as pelvic floor electrical stimulation, so kind of like a TENS unit. You can also try medications such as anticholinergic medications. The problem with these, though, as we age, is that anticholinergic medications aren't very good for our brains, and they can actually lead to confusion or symptoms that mimic dementia. So if you've started on one of those and noticed changes in your thinking, you might want to recontact your provider and stop those. And the other medication is vaginal estrogen. The next thing that can be tried if you have any type of prolapse is a pessary. This is a small device that's inserted into the vagina, and it's meant to hold either your bladder, your bowel, or your uterus in place, but it just kind of acts like a little block that sits up there to help hold things in place. Here is a new treatment that I was not aware of, but they can do office procedures like Botox injections into your bladder. And then I was aware that they can insert urethral bulking agents, or they can do peripheral nerve stimulation, but had never really heard of using Botox in the bladder. But again, urinary incontinence is not my specialty. So this is meant to be just a general overview of incontinence. And then the last one is surgery. So again, if you have some type of prolapse, they can insert a sling, which would either be a mesh or a sling that's made from your own tissue. And then they can suspend your bladder or do that peripheral nerve stimulation there as well. So now we're going to shift into talking about how we can use technology to learn how to do Kegels correctly using a new biofeedback technology called Perifit. So now we're going to switch into talking about how to do Kegels. That has always been the gold standard that's been recommended for urinary incontinence, but a lot of people do it wrong, or you're not exactly sure that you're doing it correctly. But the reason for that is one of the biggest challenges with doing Kegels is that it's hard to locate and target your pelvic floor muscles because you might end up squeezing your butt or you contract your abdomen. And really what you're trying to do is isolate and target your pelvic floor muscles. It's also hard because unlike the muscles in your arms or your legs, you can't really see the pelvic floor muscles. So it's hard to know if you're actually doing them correctly. There have been some studies that say that 1 in 4 women actually perform Kegels in a way that could actually worsen their pelvic floor symptoms, or they might be doing exercises that make things worse that aren't recommended, like stopping your pee. So that means you're urinating and you stop and then you go again and you stop, and that can actually cause more reflux, and you end up getting a bladder infection from that. So now let's talk about how we can use biofeedback for Kegel exercises. There have been several systematic reviews, meta-analyses of studies on pelvic floor muscle training with and without biofeedback for stress urinary incontinence and mixed incontinence. And the biofeedback devices that they use range from electrical stimulation devices, standard biofeedback machines, Vibrance Kegel devices. They had one called a resistance device. They called that one the Kegel Master. That was kind of funny. And then vaginal cones. But the 2 reviews that I looked at, they were of multiple clinical trials, and they indicate that pelvic floor muscle training and biofeedback are equally effective treatments in decreasing incontinence and improving your quality of life. So now let's switch into talking about the goals if you're going to try the Perifit. So if you want to stop leaking, enhance your sexual well-being, recover from pregnancy, relieve prolapse symptoms, or maintain your pelvic floor, using the Perifit device is a good way to do that. And it also gives you a tailored program and a workout schedule based on your goals. And this is actually the Perifit device. It comes in this little case. And as you can see, this one has, this stays external to your body, and this is the piece that fits in to your vagina. And the little book that comes with it and the app show you how to position these things. But you first order your device from Perifit. So it's Perifit. And they have another type of device that doesn't have that little leg on the outside. It has a string instead, but pick out the type of device that's going to be easiest for you to use. And you can use the coupon code Melissa B PhD to get 25% off. So I ordered mine, and basically all you do is download the app, you set up your account, you turn on the Perifit, and you insert it into your vagina. And again, the directions are in the app for how to correctly position it. And if inserting it is uncomfortable, using a water-based lubricant is recommended. And then as you start the app, the first thing it has you do is calibrate the device. And so you sit down, and it'll tell you when to relax and then when to squeeze your pelvic floor muscles, and it makes the little ball go up. And so from there, you can play the game. I will say that playing this game, and I have a little video that shows you this on the YouTube video that's on my website in case you're listening to this from an audio only platform. But basically every time you squeeze, the little bird or the ball goes up, and it kind of tells you how healthy your pelvic floor is. And then based on your goals, it will establish a tailored plan for how often you should continue to do the gaming over time to improve your pelvic floor. It is a little challenging. I found that getting my pelvic floor to relax was difficult, but then also knowing exactly how hard to squeeze the device was challenging too. But I think with a little bit of practice, that will get easier. So Anyways, if you would like to check out this biofeedback technology to strengthen your pelvic floor, you can order the product. Be sure to use the coupon code MelissaB PhD so you get 25% off. And if you do decide to check it out, please let me know how it goes for you. And thank you for joining me on today's episode. Don't forget that you can go to my website at melissabphd.com/join, and you can sign up to be an HyU Insider or MVP member. You can also become a member on YouTube. And please don't forget to subscribe to the podcast in whatever platform you're listening or watching on today. If you think this information would be helpful to someone else, please share it, like it, and leave a 5-star review, because those things help to get the information out to other people that it might be helpful for. So again, thank you for listening today, and until the next time, be well.